The Rockingham Fairgrounds was transformed into free healthcare clinics over the weekend. Remote Area Medical is a nonprofit organization which partners with local healthcare providers to offer free health services nationally and internationally. Laura Trull is an assistant professor of social work at James Madison University.
It seems pretty incredible when you think about it, the hundreds of thousands of dollars of services that we've been able to provide for folks for free.
Just over 600 people took advantage of the free healthcare clinics. More than 370 people received dental treatment. Over 300 people received medical attention. And 285 people received vision services, according to RAM's media relations specialist, Robert Lambert. JMU was among many partners of Remote Area Medical. Trull explained how the health clinics got started in Harrisonburg.
About 2 years ago, a number of us started working together as the local community host group. So there needs to be a community host group that does all of the on-the-ground planning here in the local community. And then we partner with Remote Area Medical, who brings the supplies and the expertise on how to put this clinic together. So they know the clinic, we know the community, and we work together to put this clinic together. So a lot of times we see folks who have not been to the vision doctor or to the dentist in many years.
Reginald Washington was at the RAM Dental Clinic to have extractions.
I had a problem with it. Every time I went to the emergency room, it cost me $500. So I finally got a chance to get it pulled today. Both of them pulled for nothing. And I ain't got to worry about paying some extra money for something I ain't had with dental insurance, which was extravagant, very high.
He says the pain was so intense that it prevented him from focusing.
It'll stop me from doing my studying. Seriously. Studying for my CDL and I got pain in my mouth. It's hard to do. And that would stop me from getting the job that I want.
Nearly 500 volunteers participated in this year's RAM clinics. Dr. Jack Friend is one of the many dentists who volunteered.
I guess I've been pretty lucky. I got to go to dental school and I get to do a good profession. So if you get to do that, you need to give back to the community a little bit from time to time.
Dr. Friend worked in the triage area and saw more than 25 patients.
Triage is where we come in and screen people to help them figure out their priority for their need that day, before we do a cleaning or a filling or anything, that people don't have something worse going on. I do head and neck cancer exams. I'm looking for peculiar lesions in the mouth that, shouldn't be there and might be pathological, would need attention. We're helping to diagnose which teeth are hurting people, or if they don't have tooth pain, which tooth they might want a filling on, or if they need a clean.
He says during a preliminary dental exam with a male patient, he noticed a potentially cancerous lesion.
There was a lesion on this man's tongue that was very suspicious, so we want to send him out actually to UVA for a specialist care to make sure it's not a bad lesion, or if it is, to be proactive and try to intercept and give that man therapy for that.
Kim Falkenbury is a RAM clinic coordinator. She says the Harrisonburg Clinic offered alternative medical care.
That's the one that probably varies the most from clinic to clinic. Dental care is at all of our clinics the most requested service, with typically about 60 to 70% of our patients wanting dental care. Vision care, we see 30 to 40% wanting vision care, and then usually only in the neighborhood of 15 to 20% wanting medical care on top of that.
The Vision Clinic offers free prescription glasses in an hour. Trull says most of the people seeking vision care have neglected seeing an optometrist.
They may have prescription glasses from 8 or 10 years ago, and we all know that your prescriptions do change over the years. So yes, they have been going without prior to this clinic.
The vision process starts with an eye exam to get a prescription. Then there's choosing an eyeglass frame. Then the glasses are created. Billy Slaver is a RAM equipment manager in the Vision Clinic. Slaver says being able to see clearly through a new pair of glasses can be life-changing.
When they put glasses on, it's a realization that they can see so much better. The grandmothers can read their Bibles now, and little children cannot struggle in schools. And people can get their driving license where they're struggling to pass the driving test. We put glasses on and they can get their driving license.
The total value of the free healthcare services provided at the Ram Clinic was more than $305,000. In Harrisonburg, Elaine Rackley with Breaking Through News.